Hi guys, welcome back to MP Now's YouTube channel. I'm Saikira, and I wanted to come on today to talk about a few tips for precepting students who are MP students, and also just to give a little bit of insight about precepting in general, because I feel that precepting is a big deal for students. And I think that one good way to give back to our profession is to be a preceptor to other students, almost kind of like paying back to those that gave to us in a way. I know that when I was in school, it was a really big deal and it was really difficult for me to find a preceptor. And the ones that I did find, they were the best. And I feel like there was a little silver lining to that because I had to really seek out the best. It took me a really long time to do that because I had to seek out the best in order to find them. It was hard work, but it really shouldn't be that hard for us. But it is, and we have to work with it. So I see a lot of students tell me that it's very hard or very difficult for them to find preceptors. There's a lot of programs that are under fire right now because of their, they promised that they would find preceptors for students and they don't. And then the student is stuck with finding them on their own. So just to back up a little bit, for students, a good tip is to basically build relationships with people and with physicians and nurse practitioners, people that have their own job, own practices possibly, and just other MPs in general, to build that relationship with them so that when you do possibly need to precept with someone, or if you need someone, you already have that relationship built so that it's easier to find someone. A piece of my hair here. Excuse me, y'all. But it's difficult. It can be very difficult. It's gotten to the point where people are willing to pay lots of money. And when I was in school, it wasn't that bad. This was back in 2013, but it's gotten a little bit more difficult. So that's just one bit of advice I would give to students. Just try to build relationships with people who possibly could be a preceptor for you, and to just learn as much as you can as you go along, because it's a process and we all have to go through it. But I really wanted to speak to my potential preceptors today, which are, I cater to nurse practitioner students, but also if you're within your first year of being an MP, I also cater to you. This is something that is relevant to you as well, that, after you've gotten to be a nurse practitioner for about a year or so, you're pretty much seasoned, they would say, and you can precept other students. So I just wanted to come on to give a little bit of information and a little bit of like how I did when I precepted my first student or students, because I started actually precepting literally 11 months after I became a nurse practitioner. And I was working a full-time job at an urgent care, and I was working in a health clinic full-time. So I did gain a lot of information. I did gain a lot of knowledge during that time period. So, I felt that I was beneficial to a student at that point in my career, and I could be of assistance because, of course, I would like, we all are here to just serve, basically. So I felt like I was able to precept. So I was approached to precept with someone, and I said yes. And they had to I had to sign paperwork and also prove that I was a nurse practitioner for a certain amount of time. And they also had faculty come to the facility that I worked at, basically kind of to check up on the student to make sure that they were doing what they needed to do. And then one of the things that I would say, I would not be concerned about any liability issues when it comes to precepting students, because there's like zero liability claims that came up against any student that had an issue, like anybody that was precepting a student at the graduate level. Like there's no liability issues. So if that's a reason, if that's an issue for you, you can look it up. I've Googled it. I've checked out books and everything, and I haven't found any issues with people having liability issues with precepting students. So you can do your research, but it's pretty much low risk because all you're basically doing is teaching them what you know. And then if you don't know an answer, you teach them the resources that you use to get your answers. So when you're working with nurse practitioner students, a lot of times patients, the preceptor will have the student go in, speak with the patient. So with that, they are allowed to do things like the vitals, the patient history. They can also do the family history, medical history, and they can also do their chief complaint. And you don't have to change any of that per se legally. So what you must do as the preceptor in order to get billed for insurances and to continue seeing all your patients, just basically you must do the review of systems. You must also do the exam on the patient. You also have to do the medical decision making, meaning, whatever they're going to diagnose the patient with. And also the complete history. That all must be done by you as the preceptor. And the student can do the other stuff and you don't have to change any of that, but you must look at it, of course, and make sure that it's accurate and correct. So that way, because you're going to be ultimately signing off on that chart. One of the things that I like to do before I even precept a student is I like to look at their objectives from their school to find out what it is that they need to hit or the objectives they need to learn. So my process when I precept students is I'll get a patient chart. I'll look at it really quickly. A lot of times I kind of know what's going on with the patient or I've already met the patient. So I'll let them go in and I'll let them speak with the patient and they'll come back out and they'll report to me whatever information they have. And what do they think is going on? If it's a sick visit, what do you think the diagnosis is? And what are you going to treat them with? And then if it's like a well visit, all right, did you find anything abnormal on your assessment? And what do you think will be your documentation? Things like that. So I basically go over my thought process with the student to give them an idea of how I'm thinking. So if I don't know an answer, or if I don't know something, I'll let them know what resources I'll consult to find the answers, whether it be a person or a publication or an app or something else. So that way that they have an idea of when they go out into practice, what resources that they can use to find out for themselves their diagnosis and things like that. Sometimes a person is not readily available. I know that there are about 23, 24, 25 states that have full practice authority. So you don't need to work under a physician. So you don't really have a collaborating physician that you can call, but there are resources that you can use that can get you to your diagnosis. And then there are physicians in the area that maybe you have a relationship with that you can call to get kind of like feedback as to what they think that might be going on with a patient. So as an example, I had a GYN patient who had lesions on her vaginal area, and I don't work with GYN patients that often, but I had a nurse practitioner who actually is a women's health nurse practitioner, and I had to consult her to find out, what do you think is going on with this patient? Of course, I'm going to refer her out, but I want to treat her and to make sure that I do everything correctly prior to letting her leave my office, because I want to do my due diligence. So that's something that whole process is going on in my head, but that's something that I would relate to the students so that they would know, okay, so I'm thinking this, all right, I'm going to look this up, all right, I'm going to call this person and I'm going to do this. And everybody has their own way of going about their practice, but at least that gives the students an idea of how to basically diagnose and how to come about and go about situations, especially those very rare situations like the one that I just spoke of. So I think that every nurse practitioner should consider precepting students, because we basically have to look out for each other, and also as a way of giving back to our profession in a way, because each one teaches one. And I really truly believe in that. But I think that's all for today. If you have any questions, please send me a message on my website. So you can find me at mpnowllc.com. And you can also leave me a message on Facebook, which is mpnowllc. You can also follow me on Instagram or send me a DM there. I answer all my DMs and all my messages. And you also can just drop a message or a comment in the Dropbox on this video. And I always respond to all of my messages. So, and also the process that I think of when I diagnose my patients, I also put in my online course. So if you go onto my website, MP Now LLC, if you're a new graduate nurse practitioner, you'll find a lot of information on there, and it'll be much helpful for you about just from the time you graduate into your first job. A lot of information. I'll take you through the steps of, how to apps to download for your diagnosing and prescribing medications and things like that. So if you want to check that out, that's on my website. So I urge you to go up to my website, mpnowllc.com. And also you can send me a message if you need anything. So I think that's all for this session, this video. So thank you for joining me. I will be back next Sunday. And be well. Bye-bye.